Christina Oriel, you also had a question for Dr. Nguyen.
Hi, yes. Hi, doctor. I'm Christine Oreo with the Asian Journal. So California this week, or I think last week, started breaking down the cases and deaths by race and ethnicity. And we've seen that 13% of Asians have tested positive based on the sample and 16% deaths. Are you seeing, but the data is aggregated and it's not broken down by the specific Asian groups. Are you seeing any particular trends among the different Asian groups that are getting affected more? So for example, in the Filipino community, as you know, a lot of them are healthcare workers. So we've heard of incidences of deaths and positive cases on our end.
I don't have any special information there in terms of the rates. I think, California is usually pretty good at disseminating disaggregated data on Asian Americans. So we can hopefully expect that when the data set is more complete, that they will show data. The only problem with that is when the numbers get smaller and smaller, it's hard to make sense of it statistically, whether or not what you're seeing is a real difference versus sort of a random error difference. But I do totally agree that because of the prevalence of Asian Americans in the healthcare field, that you would expect that there will be some disparities there.
And from Julia comes another question for Dr. Nguyen. Julia, are you on the call? There you go.
Yes, I'm on the call. My concern has to do with the continued disbelief in this particular disease from the amount of news reports and also from the continued reports that we put out. We get text messages from all night to phone calls asking us to report on the conspiracy. And it's been such a big concern that our community is not grasping it. And I can speak specifically on the Central Valley as early as even from Los Angeles. So I guess that is my concern on how to continue to explain to our community that this is totally different from the flu, because people keep telling us about the numbers comparative to the flu, and they are out, so they are not social distancing. Churches are still in service. They just don't say anything because they don't get caught. And we're told about these things, and it's very frustrating to explain this experience, and yet they're saying, well, we don't see anybody in our community, and we don't know anyone that's sick or ill, and they are meeting in groups as we speak.
Yeah, I think this is a really, really important point. I think the most important thing that we can do from the media's perspective is to continually drive home the factual messages. For example, to continue to say that this is 15 to 45 times more deadly than the flu. I mean, that message has to get across. I mean, the argument that the flu is more important is based on the fact that, in past years, the number of cases from the flu is huge. But the number of deaths from the flu also huge, but nothing compared to this. Okay, so I think you can acknowledge issues like that by saying, yes, the flu is very important. We need to take care of that. But this is 15 to 45 times more deadly. There just isn't anything out there like this. The other thing I will say, though, is that even though we have an anecdotal evidence that our own communities, particularly racial and ethnic minority communities, do have these issues, I don't think they actually have it more than white people do. There's actually a recent graph that I can send around that shows that as of like February, minorities, including Asian Americans, African Americans, and Latinos, were more likely to adapt these kinds of distancing and protective behaviors than white people do. So I think we do, on the one hand, continue to fight back on the conspiracy theory with facts that are really compelling. But the other is to also say that, we are doing a good job. We may not be doing as bad as we think we are. So.
Thank you. Thank you. The final question comes from Shristi for Virginia.
Hi, thank you, everyone. Virginia, you were talking a little bit about the distrust that Native Indians have of the healthcare system, and I was just wondering if there was any misinformation being disseminated to your community specifically.
Yeah, I think it's similar to what was just mentioned. A lot of misinformation around that there may already be immunity, that this isn't as bad as anyone's making it out to be. Any even little like myths that go out, and they thrive in a community that wants things to be better, right? We all want things to be better. So like the myth that COVID-19 was actually here in December and November, and we just missed it and there's all this herd immunity, that's absolutely inaccurate. It just, the science doesn't support that kind of claim at all. And to Dr. Nguyen's point, this COVID-19 is unlike any other virus we've seen. This is what makes it a pandemic. This is what makes it different and why these measures are in place. So absolutely. I think there's also what I've seen in our community and what's going around in other communities is more homeopathic or traditional medicines have the ability to heal COVID-19 or protect someone from COVID-19. And I think that that's also really dangerous from a cultural perspective. I will say that COVID-19 was not born out of a tribal culture or was not born in Indian country. And so it's limited to think that our medicines then can cure it. And I think that's true for so many things that impact our vulnerable communities. There are absolutely homeopathic and traditional medicines that can make someone with COVID-19 more comfortable, like they would with the common cold or flu, absolutely. But to rest our faith that they can heal somebody or absolutely protect somebody when the science isn't supporting that is dangerous. And those are some of the claims that I continually see, and they put two very important things in conflict. That is a belief, a religious belief grounded in traditional medicines and Western science. And it can be really difficult when those two things are battling. And so to try to align those the best that we can, how do these two things coexist in a way that protects and keeps our community healthy is incredibly important.
Thank you so much. And I'm afraid we have to stop the call there. Thank you all for participating. If you could please.
Well, just a tremendous thanks to our speakers. Honestly, this could have gone on for much longer. We're so appreciative of the information the three of you have imparted, and to the two elected representatives who joined us. Again, please do put your name, put the name of your outlet and your email so we can send the video to you and send collateral that Dr. Nguyen and others want you to have. Sunita, thanks for the moderating. This conference is now concluded.